Hello, everybody. Welcome members, welcome public, welcome advocates to the January 12th meeting of the Ways and Means Committee. Today's a big meeting. We have public hearings scheduled on the governor's budget proposal and on his capital budget proposal. Let us now move into the public hearing. And Ramona, did you wish to testify? I have you in two places, yes and no.
Yes, thank you.
Okay, welcome.
Thank you. Good evening, Chair Wolfus and committee members. Thank you so much for this opportunity. I'm Ramona Hattendorf with the ARC of King County. We protect and promote the rights of people with developmental disabilities and work to create inclusive communities. On the K-12 education budget, we are other. We ask for increased investments in special education to cover compensatory education. There are great investments in the governor's proposal that benefit students often pushed to the margins. Specifically, I'd like to call out the integration of early learning programs overseen by OSBI and DCYF, implementation of multi-tiered system and supports, paraeducator training, and funding for a special education family liaison. These are all really important investments. The budget, however, does not acknowledge the reality that most of our state's 143,000 students with IEPs have not been well served or served at all during the pandemic. They have lost access to individualized learning and related supports. And when developmental disabilities are present, students need consistent access to these types of supports for skill building. And when they don't have it, they regress quite a bit. So we anticipate that some students, not all, but some are going to need significantly more support to recover lost instruction. Thank you so much.
Thank you very much.
Chair Rolfus and members of the committee, my name is Daria Farvar. I'm the Public Policy Director for Disability Rights Washington. We are in support of SB 5092 due to the funding allocated to maintain Phase 1 and provide new funding for the True Blood settlement implementation. With this funding, the state will bring diversion, treatment, and support to King, Pierce, Spokane, and Southwest regions of Washington. While we appreciate the state's commitment to the phased regions, we do worry that the funding allocated in both phases is not enough. Phase 2 of implementation is in King County, which has more competency evaluation referrals than all Phase 1 regions combined, yet the state has allocated only half the funding that Phase 1 received. Additionally, our current implementation programs have reported difficulty finding longer-term housing for class members, and as a result have been relying heavily on motels and other emergency placements that do not lead to stability. After the vouchers are spent, individuals may return to homelessness and become more likely to experience arrest and competency issues. Thank you for the opportunity.
Okay, Sean, are you ready?
Yeah.
Thank you, Senator Rolfus and members of the committee. My name is Sean Latham from Stowaway in the 39th Legislative District, and I apologize. I am actually testifying on the capital budget, human services. While I generally support the capital budget overall, I don't support a few items related around the Faircrest nursing facility as well as upgrades to other residential rehabilitation centers. If you add up all the changes at the RHCs, the state would be paying between $100 to $200 million. While there are residents still at the centers, the vast majority of people with developmental disabilities, like myself, live in the community. Additionally, with local state-operated living alternatives being built, more people have been able to transition and live successfully in the community. I only ask this committee to consider, instead of just building segregated facilities, you instead use those millions of dollars to build more community options.
Good afternoon, Madam Chair and members of the committee. My name is Diana Stadden. I'm the Advocacy and Policy Specialist for the ARC of Washington State. And you should have received our smiley face budget chart earlier today.
Yeah, we did.
So thank you for hearing my testimony. After concerns that developmental disabilities services were going to be drastically cut, our fears this last summer, individuals with developmental disabilities and their families are extremely thankful for this budget, which did not make those cuts. And with the crisis in our communities with residential and behavioral challenges, especially for kids, and the closure of the one community crisis placement we had for kids. We're very grateful for the additional 15 SOLA beds, the state-operated living alternatives for children, and the 100 openings in the Children's Intensive Behavior Supports waiver. So thank you for this budget, and we're looking forward to seeing what the Senate brings to us. Thank you.
Madam Chair and members of the Senate Ways and Means Committee, my name is Alex Motteller, and I am the Policy Coordinator for Self Advocates in Leadership, a statewide group of adults with intellectual/developmental disabilities who are actively involved in changing public policy in our state and making sure our voices are heard. It is impossible for us to cut our way out of the COVID pandemic. People with disabilities cannot afford any cuts the state uses to fund essential services. Our community wants to participate in the economic recovery from COVID. Yet, the theory that the budget can be cut to make it through tough times only works in shallow recessions. Please leave DD funding intact for services that are essential to the recovery. We cannot afford any cuts. We appreciate that you are developing a plan to reduce the size of Rainer School and hope that the Senate will keep services as they are, as the governor did. Thank you.
Thank you. Adrienne.
Hi, Chair Rolfes. For the record, my name is Adrienne Stewart, and I'm testifying on behalf of the Washington State Developmental Disabilities Council. For the most part, we are encouraged by the governor's budget. We would love to see many of the proposals threaded through to your budget proposals. I would echo Ramona Hattendorf and the early learning folks' comments and concerns, but generally speaking, we would ask that the legislature include disability services and supports when applying your equity lens analysis to your budget. We have a few suggestions for places where you can name and prioritize people with developmental disabilities. But Washington was ranked recently 39th in the country for home and community-based services for people with developmental disabilities, despite having one of the best economies in the country. We endeavor to be a resource to you and to your staff, so please reach out when you have questions. Thank you.
Next is Lisa.
Madam Chair, members of the committee, thank you for this opportunity to provide testimony. My name is Lisa Robb, and I'm a regional ombuds with the Office of Developmental Disabilities Ombuds. Our mission is to inform the legislature's work to ensure safe, quality developmental disability services and to improve the lives of people with developmental disabilities. We are in support of this proposed operating budget and the inclusion of additional funding for children in home and community-based settings. And we also want to express our gratitude that this operating budget does not propose cuts to existing developmental disability services. Thank you.
Ivanova Smith.
Hello, Madam Chair and members of the committee. My name is Ivanova Smith. I am Chair of Self Advocates in Leadership SAIL. I am here in support of the governor operating budget. I am thankful that there were no cuts to DD services for people with intellectual and developmental disabilities. I think it's important that we have as much funding as possible for community supports and to make sure that people have access to the new virtual community that we are all in now because of COVID. I have this one concern about the capital budget. I would like them not to build the nursing home on Furcrest. Thank you.
Ms. Baravar, the floor is yours.
Thank you. Vice Chair Frocht and members of the committee. For the record, this is Daria Farivar with Disability Rights Washington. GRW is strongly opposed to building a $612 million forensic hospital on the grounds of Western State Hospital, as well as building a $120 million nursing facility for people with developmental disability on the ground of Furcrest. First, for the hospital. The hospital is not for treatment. It is only for restoring defendants' legal competency so that they can be sent back to jail and be prosecuted. This is an investment into a failing system. DSHS's own data shows that the majority of those who receive competency restoration services are rearrested and experience homelessness within 2 years. Instead of expanding the criminal legal system, the state should invest in community-based treatment. For the nursing facility, people with developmental disabilities should not be forced to live in segregated institutions in order to access the care they need. Further, a 2010 DSHS report shows that the institution is unnecessary because people with acute support needs can be successfully supported in the community. Thank you for your consideration. Please do not spend $732 million on ineffective ways to serve people with disabilities. Thank you.
Let's go to Diana Staton. There you are. Hi, Diana. Good to see you.
Hi there. Good evening. We're in evening now, Chair and members of the committee. We're testifying for the ARC of Washington State here. You should have received our smiley face budget chart for the capital budget as well. We are very much opposed to the 120-bed nursing facility being built on the grounds of Fircrest. COVID, first of all, has taught us that putting people in huge congregate settings is much more dangerous for them, especially people who are vulnerable health-wise anyway. And somebody in Spokane doesn't want to have to send their loved one to a nursing facility in Seattle. There were a lot of nursing homes, community ones, that went out of business over the last few years. So we could very easily put together a plan to make community nursing homes all around the state with much smaller numbers where people could be by their family and friends. The other thing is we didn't see any money in the Housing Trust Fund for the developmental disabilities set aside. And we really need those housing dollars in the community. It's a desperate situation trying to find community residential. But the one positive we have out of this is a solar farm being created at Lakeland Village. We assume this would be built on the excess property there. And we have a DD Community Land Trust that any funds that are profit on any of the excess properties at the residential rehabilitation centers go into the land trust to use for people in the community with DD for respite and employment, that kind of thing. So we're looking forward to seeing how that one turns out. Thank you.
Okay, well, let's go ahead and Mr. Norden Paul. Why don't you go ahead and start, and maybe Alex can come back to us. So you ready, sir?
Yes, thank you, Senator Frogg, and other members of the committee. For the record, my name is Jeremy Norden Paul, and I'm the Executive Director of the Washington State Developmental Disabilities Council. And first, I just want to take a moment and remind folks that the DD Council participated on the Ruckelshaus Work Group for 2 years, and we continue to be very supportive of the majority of the recommendations in the work group's 2019 report because they're focused on increasing opportunities for people to live in the community. However, we do not support building a large congregate 120-bed nursing facility on the Fircrest campus in Shoreline. And while the state of Washington certainly has a legal obligation to provide nursing services to people who need them, it's important for us to remember that nursing is a level of care, not a location or a specific building. Nursing care can and should be provided in the smallest, most integrated, most person-centered setting possible. And that includes places like adult family homes, supported living homes, and state-operated living alternatives or SOLAs. Unfortunately, there's a significant shortage of community homes, actual physical buildings, where people with developmental disabilities can live and receive support. But one way of addressing this shortage is by continuing to invest robustly in the Housing Trust Fund. And so we respectfully urge you to continue doing that. We were pleased to see those investments in this budget proposal here. And we respectfully urge you to also ensure a share of that funding is dedicated specifically for the developmental disabilities community. Thank you for your time.
Mr. Chair, members of the committee, my name is Lisa Robb, and I'm a regional ombuds with the Office of Developmental Disabilities Ombuds. Our mission is to inform the legislature's work to ensure safe, quality services and improve the lives of people with developmental disabilities. While we support some necessary capital expenditures, we do not agree with the continued investment in segregated institutional care. We believe that Washington should instead prioritize home and community-based services. Thank you.
Hi. Good evening, Senator Frogg and committee members. I'm Ramona Hattendorf with the ARC of King County. We serve people with developmental disabilities across the lifespan, including in supported living and system navigation. So there are about 35,000 people with intellectual and developmental disabilities just in King County, and they are in urgent need of housing solutions. We support and celebrate the strong investment that's proposed for the Housing Trust Fund, but we're really concerned about some of the capital projects proposed for the DDA, and especially the $38 million to remodel for Crest Active Learning Center. Crest is the residential rehabilitation center in King County. We recommend instead putting those funds into developing accessible housing for extremely low-income people with disabilities. We just don't have enough disability accessible units on the market. Active treatment is a service that is successfully provided in community setting, such as on the job employment supports. It does not need to be in a particular building or facility. Housing, however, requires capital investment. Research tells us 30 to 40% of the homeless population has a cognitive impairment, many of those with intellectual disabilities or autism. Homeless people with intellectual disabilities are more likely to be Black. They're more likely to have dropped out of school. They're more likely to be older. Loss of housing may be traced to death of a caregiver. Washington has an aging DD population, and we have no plan. People with significant disabilities are living with parents in their 80s and 90s. So we're asking you to please invest that $40 million into desperately needed accessible housing options for people with developmental disabilities. Thank you so much.
Okay, Mr. Wardell, Robert, you're up. Thank you for waiting.
Okay, my name is Robert McDowell Wardell. I am with the South Advocacy Movement, and I would like us maybe looking at building the community more instead of the Faircrest. I like the idea, but I was afraid that if we're going to keep kicking the cans, the more community service are not going to be met. Thank you.
Good evening, Mr. Chair, members of the committee. For the record, my name is Matt Zuvich with the Washington Federation of State Employees. Here in support of the governor's capital budget. There are about a dozen projects that affect our state institutions that we're very supportive of, but because of time, I'm going to just elevate three. The last one, and perhaps our highest priority, is the 120-bed nursing facility at Faircrest. We are perhaps the only stakeholder group left in the Ruckelshaus House work group that still supports the full recommendations of the Ruckelshaus House work group. We urge you to continue with that build because the Y buildings there just will not last much longer, and we need that capacity. Thank you.
All right, thank you very much.